Good morning, everyone. This is Dr. Sharan from Department of Prosthodontics. We have come across all the final steps till up to the insertion in your complete denture. So once again a brief discussion. So first you will make a primary impression with your impression compound. Then you pour primary cast with dental plaster. Then fabricate the special tray. Then do the border molding clinical procedure. Then make the final impression with your zinc oxide original impression paste. Then fabricate the secondary cast with your dental stone. Then you fabricate your denture bases either with your shellac base plate or with your cold cure resins. Then you fabricate your occlusal rims. Then you record the jaw relation, both vertical, horizontal, including your orientation. Then you articulate it. After articulation, again you do the teeth selection and teeth setting. Then you do the wax drying. Then finally you do the compression molding technique, and finally we got your complete denture. Then you do your insertion. Right? Up to these all steps are completed. Now what are the steps that should be taken or care should be taken after the post insertion? What should you instruct to the complete denture patient? What precautions you should give? What care you should give? And a little idea about some specialized dentures when there is a complete denturous condition. Right? So in denture insertion, the finished denture must fulfill the finished final denture must fulfill the physical needs, physiological needs, and psychological needs. What do you mean by physical needs? Physical needs are required to perform adequate function without trauma for supporting structures. Physiological needs is to allow proper support by muscles for good aesthetics. And psychological needs means to provide proper function and aesthetics. So these three triple P we called as, that is physical needs, psychological needs, and physiological needs. These three needs should be fulfilled by the final denture whatever you give to the patient. Then how the patient should wear a denture? So within 24 hours of wearing a denture, what patient feels? Patient will feel little discomfort because he is a new one wearing, he is a new denture wearer. Anything, it is a foreign material which he is keeping in the mouth. So it may lead to little discomfort, it will lead to soreness, and it will lead to excessive salivation. Right? So if there is excessive saliva, he has to swallow. Right? Then dentures removed every 8 hours, every 24 hours, the resulting force can damage to the tissues during rest period. The denture should be kept in water or diluted mouth antiseptic. If any pain or ulcerations or anything there, ask the patient to consult the dentist, whoever made the denture. Right? First, initially ask the patient to wear a little bit slow time. That means, what I mean to say is, for less amount of hours. Ask him to wear 3 hours, 4 hours, or if he is convenient, ask him 8 hours. Don't ask him to prolong to wear more than 8 hours during the initial, at first day, second day, and third day. Ask him to wear. Ask him to tell what he is feeling discomfort, whether he is feeling pain or whether he is feeling any overextensions, or whether he cannot swallow the water, or whether he cannot eat properly. So what problem he is facing? So ask him. Never tell the patient to use the dentures overnight. compulsorily it's a standard rule that he should remove the denture during night time and keep it in a clean water. Never ask him to keep in a hot water or warm water. Ask him to keep in a cold water, right? So all these precautions you have to give when you deliver the patient, complete dentures patient, a complete denture, right? Then there are some misbeliefs and some misunderstandings. The patients always compare with the other patients, right? You must motivate the patient and inform the patient that all the denture wearers are not same. Depending upon their individual condition, the denture objectives, I mean your retention, stability, support, aesthetics changes. So never ask the patient to compare their new denture with the other person, right? As I said, it always differs, right? And appearance with the new denture, they might feel strange, bulky, fullness of the lips and cheeks. They may be, they will feel that they have to change their hairstyles and everything, what not. So ask the patient that there will be some discomfort, and they can feel the fullness, they can feel the fullness of the cheeks because there are no teeth. So whatever, how best you do, it's a new one and it's a completely foreign particle which they are going to place in their mouth. So all the difficulties should be explained by the dentist and ask the patient to follow them, right? Then what happens to his speech? Initially there might be speech difficulties. They can pronounce some words or they cannot pronounce some words properly. They will feel some difficulties. In Telugu they can say మాట్లాడేటప్పుడు తుస్సుమంటున్నాయి. The patient complaints tell like that because there will be problem, right? So we have to tell the patient, and you ask the patient to be conscious whether he is coughing, sneezing, and never ask the patient to swallow the water directly, swallow the water directly with the in the mouth. That means if I tell you in Telugu, you can understand. మీరు పేషెంట్స్కి చెప్పినప్పుడు నీళ్ళు తాగేటప్పుడు ఎత్తుకొని తాగొద్దని చెప్పండి, ఓకే? డైరెక్ట్గా గ్లాస్ పట్టుకొనేసి కరిపించుకొని తాగండి అని చెప్పాలి, రైట్? యూ కెన్ అండర్స్టాండ్. సో దీస్ 2 points you have to remember. So whenever he sneezes, whenever he coughs, there might be the dislodgement of the denture, right? So you ask the patient, don't get embarrassed. These are all the common problems that every complete denture wearer faces, right? Then mastication. You should ask the patient to take the soft diet initially. Patient is asked to avoid sticky foods and hard foodstuffs, right? And patient is asked to chew bilaterally because they were not having any periodontal support. You are giving just the dentures on the ridges, so there should be bilaterally balancing, right? So I should ask the patient to chew bilaterally, right? Then very important part, denture hygiene. So you should ask the patient to rinse mouth properly before wearing dentures. Dentures must be cleaned properly before and after meals, if possible with your denture brushes, and ask the patient to clean tongue and skin over the bone properly and massage the skin over bone gently using clean finger. And patient should not use any abrasive or detergents to clean the dentures. Patient should not make any adjustment or repair by himself. Inside the surface of the dentures must be cleaned delicately using clean finger and wet cotton, right? So all these things, denture hygiene instructions should be given by the dentist. You should ask the patient to clean the denture every time after a meal whether it is a breakfast or lunch or dinner, ask the patient to clean the denture. Ask them to clean his tongue and all the surfaces of the ridges and everything, and if possible massage the tissues, gums and everything, right? And you should insist the patient to don't repair by himself. There are some patients who can who tries to repair by themselves, because they will observe you, because you will be working with your some type of birds and sandpapers, everything. They think they thought going to the dentist once again is a hectic work, and so they try to repair by themselves. So you should insist them to avoid it, right? And don't use any abrasives. Abrasives means nothing but your toothpaste. You should never use immediately your abrasive agents on the teeth, because this may interact with your acrylic teeth and may cause to the color damage, everything. So all the denture hygiene instructions should be given. Then how they have to clean? They can clean by manual cleansing, that is brushing, used with the mild detergent or denture paste and water, mild abrasive, right? Remember, use of regular paste is contraindicated. Abrasives can cause wear of denture. Remember. So, as I said earlier, use of regular paste is contraindicated. Abrasive can cause wear of denture. They clearly mentioned we have to use a denture paste and water, right? Caution, what you have to use, what you have to keep in mind. Stiff bristles can cause severe abrasion. Impression surface should not be brushed too aggressively, right? This is the point you have to remember when you are doing manually. Then there are chemical denture cleansers. Most preparations contain sodium hypochlorite. Boucher, that means according to Boucher textbook, there is a recommendation that a 30-minute soaking is sufficient to remove stains. Dentures are left for 15 minutes or even night. Tablets are also there which effervesce when dropped in water, releasing bubbles. Cautions, that is, important thing is sodium hypochlorite not indicated in dentures containing chrome, cobalt or other metals. And there are ultrasonic cleanser also. Use vibrator energy to clean the dentures. It is very effective in removing calculus, or there is a, if the patient has cigarette and coffee stains, right? So once again I repeat you, we can clean by manually and chemicals like denture cleansers, and there is ultrasonic cleansers also. Manually you have to keep, you should never use regular toothpaste, and when impression surface should be cleaned very gently. And when denture cleansers are used, they can be cleaned by immersing the dentures in water containing denture cleansers for 15 minutes, or even they can kept in a overnight. And when you are using metallic dentures containing cobalt chromium, don't use sodium hypochlorite, right? When there is a patient is having a cigarette chronic smoker, or any coffee stains, etc., they can be cleaned thoroughly by using ultrasonic cleansers, right? Then those are all how to keep the denture hygiene. Then what care should be taken for the dentures? You should avoid dropping of the denture. Always ask the patients to keep a vessel, then clean it proper, sit and clean, right? They should not do self adjustments, right? And for as I discussed, after every meal we have to clean. They do not use any boiling water, and denture should be kept in water or dilute antiseptic solution. See, this picture can clearly say whatever all I said, how to clean, what should be used, right? And overnight what we have to keep, right? Then if the dentures are not being weighed regularly, what should we do? Then the denture should be immersed in a dental cleanser solution, that is tablets dissolved into water. Use it to soak dentures every night. Dentures need to be kept moist when not being worn, so they do not dry out or lose their shape. Immersion cleansers are indicated and safe for all dentures. Dentures should never be placed in hot water as it can cause them to warp and fit improperly. So we should not use in boiling water, and you should not use in we should not use in dry conditions. It should be always kept in moist condition. What happens if you use on dry conditions? There may be chances of the distortion of your denture or polymerization shrinkage may occur. So all these changes occurs. So just how you keep the denture night time, it should be kept like that when you don't use the denture in days by days, right? So all these points you have to kept. As I said, night always it is advised to remove night times. And periodic recalls, that is, you should keep the touch with every complete denture patient periodically. Ask the patient to come in for after 24 hours, after 3 days, after 1 week, after 15 days, after 21 days, and after 1 month. So, and like that after 3 months, after 6 months, like that. So that how the patient is using his denture, whether he is maintaining denture hygiene properly, right? Whether there is any denture wear, how is the position of the teeth, whether any attrition has been taken place or anything, right? So all these things you can see in periodic recalls. And as I said, there will be miscellaneous means some patient just leaving the denture, he is not wearing properly. So all these things will be present. Remember one thing, if you can clearly observe, if the patient has come up with you with a complaint after 24 hours or 3 days, like that, that means patient is wearing his denture. If he is saying that he is not having any complaint, that means patient has just kept in a showcase. There will be some post insertion problems for every denture or in almost in all conditions. Even if the edges and everything is also good, there will be some post insertion problems. There might be soreness, there might be some slight discomfort, everything. If he is saying some mild problems, that means patient is wearing his denture. Otherwise patient is not wearing his denture, just he is keeping in a almirah or showcase, right? Then you've come up with this some specialized complete denture. This is generally we discuss in the post graduation section. Just I will show what are the special complete dentures you can come in your complete dentures. There are reservoir dentures which we generally indicate for xerostomia patients. You know what do you mean by xerostomia? Xerostomia is nothing but a generalized dryness of the mouth which may be caused due to some systemic conditions like Sjogren syndrome or severely diabetic conditions, right? So in that conditions we advise the salivary reservoir denture. In this type of dentures, we create a space for the injection of the artificial saliva, so that when the patient wear the dentures, the condition of the oral cavity can be kept moist. You know what the role of the saliva in complete denture patients, how saliva is important, how saliva improves the retention, right? So that's why these reservoir dentures are planned for the xerostomic patients. And in some conditions, in some patients we use the hollow dentures. That means if depending upon the what space, freeway space or particle space, in some conditions what might be, we prefer some hollow dentures. That means we reduce the weight of the denture. So that time we fabricate some specialized dentures called as hollow denture. And this is other specialized denture which we call as hinged mandibular complete denture with swing lock, right? So there might be post cancer therapy patients, chemotherapy patients. In such cases there might be less amount of the or compromised ridges, where buccal branches may be reduced. In such conditions we may use the hinged mandibular complete denture with swing lock. This is one type of special dentures. And there might be sectional dentures where they have to, they will keep section wise and they interlock it with some attachments, right? These are sectional collapsible dentures, and regularly with tooth supported dentures and implant dentures, right? This is your implant dentures. You can see implants placed and abutments placed and denture has been placed, right? So finally, the patient must be informed that continued success depends on regular denture maintenance at home combined with periodic consultation with the dentist, right? So your post complete denture insertion instructions are very very important, right? How what are all the hard work you do till now should be conveyed to the patient, and ask the patient to have the periodical recall, periodic follow up, and observe the patient how he is using his denture, right? Then only patient gets satisfied, then automatically dentist gets satisfied. Remember, always complete dentures success depends in satisfied complete denture patient. If the patient satisfied with his denture, if he uses his denture properly, if he eats it with the denture properly, automatically denture is success. That means you are giving him completely a new life, you can say, because he is not having the teeth, he is suffering with the problem, anything. You are eliminating systematic problems. You are making the patient to smile very happily. You are making him to go and face the socialistic life. So all the things you are giving, that means you are giving a new life. You are the recreator, right? So always, if that complete denture is success, that success is very very awful. That means very very happy, both the dentist and the patient, right? Thank you very much.